firstly like to acknowledge Aboriginal and Torres Strait Islanders as the traditional custodians of the land on which we walk, and the elders past, present and future. Our primary population group are Indigenous Australians aged 30 to 50 years. Indigenous Australians suffer greatly from preventable chronic illnesses such as cardiovascular diseases and cancer being the main causes of death. Based off this, Indigenous Australians will have specific health needs in order to improve their overall health, life expectancy, life quality, and close the gap. The first health need for Indigenous Australians is more easily accessible and affordable healthcare services, with health professionals who are culturally competent with Indigenous culture to be able to build trust or even more Indigenous-based health services. This is a health need as access to health services can help treat chronic illnesses such as cardiovascular diseases and cancers with various medical procedures and medications, as well as prevent them with the use of screenings. The second health need for Indigenous Australians is more education on health. They require more education about healthy eating and daily nutritional requirements to help make more informed choices about their nutritional intake. Examples include drinking plenty of water throughout the day, eating fruits and vegetables, lean meats, and removing fast and processed foods which contain excessive fats, oils, salts, sugars, and preservatives. The Indigenous also have very high substance abuse of alcohol, drugs, and tobacco, in which have detrimental health effects, which must be informed about. They also need education on the benefits and importance of regular exercise of a moderate intensity, not only for their physical health but their mental as well. The final health need for Indigenous Australians is more culture-based community campaigns and services. Indigenous Australians don't just limit their health to physical health, but regard their cultural health as equally as important. For Indigenous Australians, culture is their sense of identity and who they are, as well as a connection between themselves, families, communities, and the land. These health needs are greatly influenced by the effects of colonisation. The term terra nullius was used when British settlers first arrived, meaning nobody's land. The British settlers deemed the land as uninhabited due to no hierarchical rule or feudal system, no infrastructure, and the Indigenous had no possessions such as currency or food. Therefore, colonisation is the cause of the disruption of the four elements of Aboriginal society, which are language, land, law, and law. The consequences of colonisation towards Indigenous Australians has been the transgenerational trauma, which has caused a lowered self-esteem, the destruction of culture through assimilation into the non-Indigenous and stolen generations. They have a distrust for public health services, and they have higher unemployment rates compared to non-Indigenous individuals, which has led to a lower household income. Therefore, they have limited education options, making use of public schools, and they are also unable to afford for tertiary education. They have limited housing opportunities, making use of government housing, rental properties, and living in rural or remote locations, and they have an unaffordability for fresh, healthy, and nutritious foods.
In response to these historical factors and health needs which have had a negative impact on Aboriginals and Torres Strait Islanders, it is important to acknowledge these factors and needs as a health professional and to have the following skills and information. Firstly, it is highly crucial of a health practitioner to be consciously aware that cultural barriers do exist. In that way, certain interventions can be integrated into practice to ensure better health outcomes and enhance the quality of health services, such as strengthening the cultural competency of healthcare professionals and the healthcare system. The process of cultural competency includes cultural awareness, cultural knowledge, cultural desire, cultural skill, and cultural encounters. By achieving this process, not only does it eliminate bias, discrimination, and inequity in health services, but also can be part of an effective solution in decreasing premature death in Aboriginals and Torres Strait Islanders. A health practitioner can aim to practice and utilize these techniques by gaining a better understanding of the group's beliefs and practices and incorporating those in health services. These skills and resources are crucial to adapt in overcoming the negative experiences that Indigenous Australians have when using health services. These negative experiences include, but are not limited to, racism, bias, cultural barriers, and stigma. Middle-aged Indigenous Australians have had a significantly higher rate in chronic conditions such as cardiovascular disease, and therefore, according to Conway, Sutos, and Lorne, chronic conditions are majorly the result of the life expectancy gap between this population group and non-Indigenous Australians, which may have been a result of those factors above. Indigenous Australians have experienced exclusion and marginalisation from Western health services and biomedical models of healthcare due to cultural differences in health belief systems, and more so the effects of collective trauma and colonisation of past generations. Further evidence suggests that there is a higher percentage of unmanaged chronic conditions in 30 to 50 age group Indigenous Australians compared to non-Indigenous Australians due to barriers accessing Western health services because of mistrust, fear, neglect, and cost, which has ultimately resulted in a larger death gap between the two comparing population groups. However, utilisation of Aboriginal community-controlled health services is known to have benefited the community by integrating their culture and values in their health services. In comparison to Western health services, these community-controlled services have had a significant impact on Indigenous health over the years and have resulted in a healthier community as it has contributed to reducing cultural barriers and racism.
Although Aboriginal and Torres Strait Islander people are a group with their own specific health needs and experiences, it is evident that improving their health needs could ultimately improve the health needs of other minority groups. Likewise, another minority group we have researched are middle-aged African people. Similar to the Aboriginals and Torres Strait Islander people, many have experienced the negative effects of colonisation. In addition, the health needs are somewhat similar and include access to sanitisation, sufficient healthcare, access to transportation, and sufficient housing. While African people and Aboriginal and Torres Strait Islander people share health needs, there are multiple circumstances that differentiate the two groups. For instance, for African people, living in a third world country creates barriers, which in turn affects their way of accessing healthcare. Perez et al. Discusses the need for health promotion in South Africa due to the abysmal health trends and the focus on only the sick and not the prevention. This biomedical model of healthcare presented indicates that African people's health needs aren't being met, and while Africa is classed as a low to middle income earning, access to healthcare is out of reach even for the wealthier population. While in Australia, the government has created healthcare facilities specifically catered to Aboriginal and Torres Strait Islander people and the lower income earners. Although these groups have varying living arrangements, there are some key similarities between these two groups which has pushed us to choose these two. Fundamental similarities include economic burden, limited education on healthcare-related services, bias towards a minority group, and cultural barriers and racism due to impacted colonisation from the British government. As healthcare professionals, having a skill set that caters to all culturally diverse clients is a key part of improving and maintaining healthcare. Communication between other healthcare professionals and patients is important in developing a patient's journey, and without it, mistreatment or injury could occur. Another key skill is active listening and empathy. Effective communication stems from healthcare professionals who have developed active listening to which they can listen to the content, feelings, and intent of the message. According to Jerome et al., Active listening involves the practitioner being active in the conversation by responding with questions and using a variety of verbal and non-verbal communication styles to convey their interest, such as their posture, open body movement, and eye contact. With this, empathy plays a big part in ensuring the client feels comfortable and as though what they have to say is important and meaningful in their journey throughout the healthcare system. While there is no direct contact between paramedic crews and sports physiologists, it is a part of the health professional's duties to be able to communicate their goals to the patient efficiently, so that if a patient had to relay the information, for instance in an emergency situation with paramedic, they could do it with accuracy and understanding. In saying this, being culturally competent and culturally safe means that healthcare professionals can approach their methods of treatment while still catering for the diverse population. According to Rhonda Livingston from the Australian Children's Education and Care Quality Authority, being culturally competent means being able to understand the differences between different cultures and then being able to strengthen one's knowledge and work towards equality within their scope.
Considering these findings in regard to the readings and our own research, we've developed the following strategy to educate Indigenous youth in schools of the effects of cardiovascular disease and to reduce the risk factors of CVD itself. Not only does this strategy focus on a holistic approach by two different health professions, it also responds to the following two social health determinants: education and cost. For our health strategy, we have decided to create an education program that focuses on teaching Indigenous Australians the necessary tools and knowledge to prevent CVD from occurring. As a sport physiologist, it is important to focus on prevention rather than focusing on early intervention. This is why our program will focus on going around in high schools in rural areas that are heavily populated by ATSI Australians, teaching young adults as a demographic rather than adults in their 30s to 50s in order to further promote prevention. The program will focus on teaching these individuals the dangers of smoking. According to McBride, cigarette smoking is considered one of the three main risk factors of CVD, which is why it's important to help ATSI individuals have the knowledge of how dangerous smoking can be towards their health. As sport physiologists and paramedics, it is important to understand that many ATSI Australians may have already been exposed to smoking, so it is crucial that we do not make them feel guilty for their choices, as this can have a negative effect on their mental health. As health professionals, we also need to look at the importance of educating ATSI Australians on the crucialness of regular screening. As young adults, it is important for these individuals to understand how regular screenings can assess the risk of CVD and can have positive impacts and reduce their risk of CVD itself. We will hold this free service after school hours and will allow Indigenous youth and parents to contribute. Paramedics can participate and share their clinical knowledge on CVD and past experience with patients. Making this a free service will benefit the community by reducing cost and increasing education, free of the burden of cost, which as social determinant we are tracking. To show a holistic approach to this program and not keep it strictly to teaching, integrating a physical component to the program can be beneficial and add a fun aspect to the program as well. A 30-minute session of dodgeball not only will make a fun and interactive activity for the community, it will also set an example for the health professions that exercise has many benefits in reducing the chances of CVD. According to Nistarak and Bagnago, frequent exercise will decrease the risk of developing CVD and therefore decrease mortality rates, and found that they had beneficial effects on their health overall. To modify the strategy and suit African immigrants who have travelled to Australia, we need to look at the barriers they encounter in terms of learning. To properly teach these individuals the right knowledge and tools, it is important to understand they may not know English very well. Providing African immigrants with a further English studies can go a long way with not only helping them understand CVD, but with also other aspects in terms of living in a new country.